Usually when we think of Ehlers-danlos syndrome, we think of 13 distinct types. However, there's actually more than 13. There are types that are currently not classified, however, they are known types. They simply just do not fall in that list of 13. Today we're going to sit down with Maddie and Lacey, who both have unclassified types of EDS. They actually also both have Instagram accounts where they talk about their experiences, so I'm going to leave both of their account names down below in the description, so feel free to give them a follow, and also feel free to subscribe to my channel if you want to see more similar content. Right now we're sitting down with Maddie, who actually has an elastin mutation. So Maddie, do you want to tell us a little bit about your journey with symptoms and your journey to diagnosis?
I always had joint pain as a kid, and then it was kind of dismissed. I always had like extreme fatigue. So like the basic like EDS as a kid signs. But I didn't really start having major health issues until I was 13. I lost vision in one eye overnight. We're like, okay, this is kind of weird. Was in the hospital for a week, got a spinal tap, like 6 MRIs, like did the whole thing. Thought I had MS for a little bit. Turned out normal, and they were like, okay, well, just go home now. So we went home, and then I saw a rheumatologist, and I was like, something's up. And he was like, well, you're kind of hypermobile. Like maybe you have EDS, maybe not. I don't know. Go see a geneticist. So I go to see a geneticist, and like I had other issues develop. I was diagnosed with POTS. I started having stomach issues. I developed CRPS, AMS, Hashimoto, like all the things. And then we were just kind of like nothing fit together. I saw my geneticist, and she thought I had Marfan's or classical EDS. Those were like her top two. She's like, that's what you're gonna have. We got genetic testing like 6 weeks later. It was February 24th. We got the email, you have an elastin mutation. And we're like, okay. And she's like, well, it could explain your joint symptoms. And it probably does. Skin symptoms, like I have stretchy skin, but then in some places my skin's kind of tight. But there's just like, it's like all the EDS symptoms plus 20 other things that they're like, we don't know.
Elastin is a fibrous protein found between your cells, and that area is called the extracellular matrix. It's actually the second most important protein within the extracellular matrix, and the most important one is collagen. Now, elastin is kind of elastic, hence the name. It's kind of like a spring. You can pull it apart and you can let it not be pulled apart. So there's basically a relaxed state where it's just chilling, and then there's a state where it's being stretched. And what's really cool about elastin is that once you stop stretching it, it returns to its normal shape.
Elastin, it's supposed to kind of be like a rubber band where it's kind of supposed to stretch and then go back. But basically mine, it's like, it won't stretch all the time. So it's kind of like it will either get too tight or really loose. And some people with my mutation will have like half and half. Like there's one person that I read a case study, like half of the right side of his body, it's really tight. The left side is super loose.
So right now we're talking with Lacey, who has PVEDS or PVNH.
So I was diagnosed with PVNH and EDS when I was 18 years old. And I was diagnosed first with an unclassified rare type, that they knew that I had a rare type, but they weren't quite sure which rare type I was going to have. So I was sent to genetics, and I had several genetic panels done, and it came back with a mutation in the FLNA or filamin A gene. So that was the first time that I'd ever heard of periventricular nodular heterotopia. And so basically what it is it's a congenital brain disorder that also crosses with EDS.
Got it. So it's like it's two different disorders kind of combined, is that right?
So it's two different disorders, but they overlap to form a specific type of EDS and a specific type of PVNH.
Lacey's mutation is in filamin A, or FLNA. This is a protein that helps to regulate the reorganization of the cytoskeleton, which is the part of the cell that actually gives it its structure and provides them with the flexibility to change shape. Lacey's mutation makes the cytoskeleton disorganized, and it also affects the way in which different cells adhere to each other, causing some issues. Just like with basically every type of EDS, Maddie's elastin mutation and Lacey's FLNA mutation each cause them specific issues and specific symptoms. So let's talk about some of those symptoms that are specific to their type or to their mutation.
It's a lot of like skin things, and I also have a lot of bone deformities. I have 2 in my feet, 1 in my hand. I have pectus cranium. I am missing part of my tongue, but it's really just like a lot of like structurally compared to family members, I'm just like very differently, especially bone wise, because I have multiple bone deformities that they don't.
So usually the first thing that clues people in to that they have PVNH is seizures that start around late teens, early 20s. So I did start to have partial seizures or vocal seizures around my late teens. And then also some people have MRI findings of PVNH and some people don't. It's never showed up on any of my MRIs. But I also have like mild aortic dilation, which is very common in this type. And then I also have mitral valve insufficiency, which is also pretty common.
You might be wondering, why would these be unclassified types? Why wouldn't they just be classified as their own types, and maybe there'll be like 25 different types? And I think that's a really good question that I don't fully have the answer to, but I can kind of speculate, though I'm not sure if it's correct. I also assume that there's probably multiple reasons, but like one thing I can think about is that with classical EDS, there are 3 mutations that mainly cause it. So COL5A1, COL5A2, and COL1A1. Right there, that's 3. However, hypermobile EDS is way more common than classical EDS. So there are going to be certain mutations that might lead to the same type of presentation, so they should be classified together, but then all of us with HEDS have a lot of overlapping symptoms, so is HEDS really just maybe 20 different gene mutations? Just like with classical, there are 3, and it wouldn't make any sense to separate them because they all cause basically the same symptoms, and differences where somebody with this mutation and somebody with this mutation can be potentially more similar to each other than 2 people of the same mutation. If that makes sense, that's just a guess. Another thing is, well, at what point do we keep classifying these as Ehlers-danlos syndrome types and not other connective tissue disorders? So it just might be a little bit too early in the process to be able to separate them, even though somebody might have a known mutation and they don't fully fit under any of the current categories. They might just be classified as like, you have this mutation, you have a type of EDS, we don't know what type, or they might still be labeled as hypermobile EDS with a known mutation. I just think overall it's too early to really be able to very properly separate them, but it is kind of confusing, like that there's more than 13, which is also why sometimes you see people say more than 13 types, which I try to say over just 13 types. It can be quite life-changing and confusing, maybe even exciting to find out that you have a different type from what you thought you had. I know for me, I have hypermobile EDS and I had genetic testing that confirmed I don't have the other types. But I can imagine it'd be quite interesting thing to process when you find out that you don't have the type you thought you had. So let's talk to Lacey and Maddie to find out what their experience was like when they found out they had a mutation.
It was a weird day because I remember I like kept checking my hospital has a portal with like emails, and I was checking like every day, like waiting for the report for like 4 weeks, and then it wasn't showing up, and I was like, okay, maybe it's nothing. And I remember I got in the car, I was coming home from school, and it was snowing, and my mom's like, we got the results, we'll talk about it when you get home. So she's like, you have an elastin mutation. And I was like, what? We didn't even discuss the possibility of an elastin mutation at my point, because she was so convinced it was Marfan's or classical. That's all we went over. So I was just like, this is so weird. So then it was like going down the rabbit hole of like trying to Google it, but like 2 studies show up, and you're just like, well, or like Williams syndrome comes up because that's an elastin disorder, but I don't have Williams. So it was just kind of this weird overwhelming of what is this? And then just them being like, well, we don't know. We'll see you in 2 years.
So I was expecting to be diagnosed with either like a classical EDS or vascular EDS, or even something like cardiac valvular EDS, because I did have some heart valve issues. And so that's what they thought led to me having a rare type. So I was expecting one of those types, and then I came back with a mutation or something completely different. And so my rheumatologist is who ordered my genetic panels, and she had never seen anybody with a filament A mutation. So then I had to go see a geneticist who specialized in connective tissue disorders. And I had to wait 13 months to get into that geneticist, like waiting and thinking about, what does this mean? What does this mean? But it was eventually worth it to be diagnosed.
Nobody else in your family has this?
I have like family members who have other conditions, but no one to the level or like same symptoms as I do.
Do you have two mutations? It's like two and it's recessive, or is it dominant? Do you know?
It's a dominant one. It's a autosomal dominant. It's ELN 7Q1123C647.
Oh my gosh, I cannot believe you just remembered all those numbers.
I know. Number of doctors I've had ask me that I just at this point, it's just like I can rattle it off.
So have they ever seen that mutation before?
I don't believe my doctor's ever seen it. It has been seen in about 400 families worldwide.
Wow.
So they're predicting that it's like 1 in a million, but it could be more, it could be less. But most of the families who have it, like the one main family that like everybody in this family had it in Germany, they all died of a heart condition. So they can't study them. So they're just like kind of like, I'm kind of the science guinea pig at this point for my hospital. So there are some people who live to a long age. Some people die of a heart condition, which luckily I don't have the secondary heart condition.
Have you met anybody else with an elastin mutation?
Never. I would love to. Like the number of times I've just like gone on like Instagram or stuff or like YouTube and just search like elastin mutation. I'm like, maybe I'll find one person, and I haven't met anybody.
Have you, I guess, do you have any comments about like what it's like having a known gene mutation or having potentially probably not HEDS in a community where most people have HEDS?
I actually talk about this a lot in my account that a lot of people will like want an HEDS diagnosis, and since I don't have one, like I do and I don't, it can be kind of isolating because I can't just like reach out to someone and be like, oh, what have your doctors done? Or like, oh, do you understand this? Because there's no one there. So it's kind of like isolating because I can't find support online or support in person. So that's kind of like annoying. And I've told like friends and teachers before that know about my condition, like the fear of the unknown when they tell you it's a variant of uncertain significance, but like with the this Peruvian score and like the deleterious effect, they're like, it's damaging your body.
Yeah.
But we don't know what it's going to do in the long run. We don't know if it's going to affect your life. So it's kind of isolating because you don't get to just like look at everyone else and be like, oh, we can relate. It's like, oh, I relate, but for a different reason. So there's always that boundary.
Now, do you feel like you connect and have shared experiences with people who have, say, like the hypermobile type, the classical type, or does it feel pretty different?
A lot of things are definitely the same. Like I do have joint manifestations, like I have dislocations, and I also have gastroparesis. So I do have some things in common with hypermobile EDS patients, but you know, some things are different, you know, like more severe heart problems. But I think all in all, I do relate to HEDS patients.
I would love to hear a little bit about how your treatment from doctors and other medical professionals has changed from the time where you were not diagnosed, but you had some sort of connective tissue disorder, to finding out that you actually have PV-EDS.
So not a lot has changed drastically. I mean, I wish that there was a great treatment for EDS, you know, obviously. But the biggest thing that's changed is knowing precautions. And so people with PV-EDS can have strokes. And I actually had a TIA, a mini stroke, a few years ago. So I always have to be careful and know that I could have another TIA or a bigger stroke later in life. And then also, patients with PVNH need aortic monitoring for the span of their lives. And some people with PVNH and other vascular involved EDSs need to take medication like losartan to manage the size of their aorta. And then they sometimes also need aortic valve replacement. But other than that, still is, you know, the general principles of treating EDS, of physical therapy, bracing, you know, drinking extra fluids, self-care, those sort of things.
We're more careful with like other treatments that could involve like muscle relaxers. We try to stay away from, just because like with elastin, knowing it's faulty, it's just kind of like, especially smooth muscle relaxers, we try to stay away from, because since elastin's primarily in smooth muscle, they're like, we don't know what it's going to do to you. But it's really just, I've been doing like a lot more PT, just because since we know my gene is faulty, my protein's faulty, so there's like more of a risk of degeneration. So that's like really the main thing. But it's basically, it's just HEDS treatment, but a little bit more intense. I've had major dislocations, and I have like my whole life. Like last quarantine, I dislocated my collarbone sneezing. I was dislocating my right knee 3 to 4 times a day when I was a competitive runner. In my knee dislocations, it doesn't go out, it goes to the inside. I finished a race the one time and my kneecap was like the other way, and I was like, oh, I'm gonna go sit down now.
I've met a few people on Instagram who've DM'd me with it. They say, based on literature that I've read, that they think there are around 100 people who have been diagnosed with PVNH EDS. But I think it's way more than that, because, you know, maybe 10 to 15 people have reached out to me who have it. So I think it's probably in the thousands of people who have it.
Even though, like, I know you're not a medical professional or anything like that, but like you said, it probably, you know, is underdiagnosed, so there's more people who have it that we even know. If there's somebody out there who's diagnosed with EDS or their doctor suspects it, what symptoms might they look out for that would indicate, maybe I should ask my doctor to test me for PVNH?
Certainly, if you have seizures that appear later in life, like in your late teens, early 20s, and if you have a pattern of X-linked inheritance through your family, and then if you have heart valve issues, or atrial septic defects, or aortic dilation, those are just some general things that may point to having PVNH related EDS.
I can imagine it must be annoying when people, you know, only talk about the symptoms that describe 1 or 2 types. Yeah. I'm wondering, does it bother you when people say like EDS is just a collagen mutation when like it's literally not?
Yeah, So filamin A is a collagen encoding mutation, so a collagen encoding gene. So it's kind of like a collagen disorder, but kind of not a collagen disorder, but yeah.
Is there anything that, I don't know, like kind of a broad question, that you would want people watching to know, either about your mutation, about your experience, anything that you want to really talk about?
For just like experience of like having a genetic condition diagnosed into teens, because you hear a lot about the kids who like have something very obvious and they're diagnosed as babies, so they kind of grow up being used to it. But like, I think the one thing that I would say, especially like teachers or just adults with like teens or kids in their life that have mutations, just being patient and understanding, because the amount that gets thrown onto your plate as a 16-year-old with a rare mutation that's like being given up for science, it's stressful. You're always thinking about what you can and can't do compared to your peers or just other people your age. So just being understanding. And also, I love it when people try to learn about my conditions, like friends. I absolutely love that, because it means the world. It's just like, oh, you actually acknowledge that this is a part of who I am. So that kind of applies. I mean, you can't really learn about my mutation. You could read the 2 studies. So, but yeah, just being really understanding and patient and like listening to people is something that I really think people need to do more of, and just like kind of taking a back seat instead of just being like, well, because like reading about your condition is a little bit different. Because like they'll be like, well, I read this, but it's different than the experience. So just like listening to people is really important.
A huge thank you to both Lacey and Maddie for coming on my channel and sharing their experiences with a unclassified type of EDS. They both have Instagram accounts, so Lacey's is more than midodrine with periods in between, and then Maddie's is chronically.stretchy. So go give both of their Instagram accounts a follow. Thank you so much for joining me on this video, and look out for more content in the future where I talk to people with different forms of EDS to hear about their experiences and also learn a bit about their condition. So see you guys on the next video. Bye!